We know that 42 million shillings has been so far spent on leasing ambulances, 4 million for tea and snacks, and 2 million for airtime. Mr. Githongo, thank you very much for joining us to our webinar today. Our first question is, in your opinion, has the government of Kenya so far handled the spending of COVID-19 response funds with transparency and accountability? John.
Thank you very much. Yeah, that's an interesting question, especially considering the kind of headlines we've seen over the last 3-4 weeks in particular, vis-a-vis the spending by the Ministry of Health of funds that were said to have come from the World Bank. I think a bit of context is important. I think, first of all, the Ministry of Health has a new minister, and I think that's important during this particular kind of crisis. And he is, he's proactive and is engaging the public in a way that is definitely positive. I think Africa has generally done fairly well in responding to COVID-19. So, so far it's a success story. Maybe in the second round of infections, things may get difficult, but so the response has been good. The Ministry of Health has been a crisis of corruption for many years, and so some of the figures that you have shared of the misspending, the alleged misspending of for the COVID-19 pandemic mitigation and response is not surprising. I mean, this is a ministry that has been plagued by all manner of challenges. It's 2017. You remember they bought a whole 7 billion shillings was spent on scanners, and we paid 227 million shillings per scanner, which is worth between 40 and 50 million shillings. So the Ministry of Health has been a scandal-prone ministry, and one would like to think that this crisis will be an impetus to change that. And I again, I've read in the media about changes that have been made by the minister in the ministry following the exposure of the latest scandal around the spending of COVID-19 funds. So that's my short answer. What I would add to that is that around the world, it doesn't matter where it is, when governments are responding to a disaster, it could be an earthquake, could be a hurricane, tornado, whatever. We've seen these disasters hitting many countries around the world. When the governments are forced to spend large sums of money very quickly, you will invariably have, just incompetence, corruption, things fall through the cracks and by the wayside. As a result, and I think that's something that we have to also take into account. Hurricane Katrina in the U.S. Was followed by an inquiry into corruption around and incompetence and misspending around the funds that were made available to respond to that particular crisis. The Haiti earthquake, same thing. So the huge sums of money being spent quite quickly, especially in a country like ours, which is systemically corrupt. Some of this money is going to be stolen. As a result, I think, quite frankly, people are ignoring the government's advice, which is to channel all their resources through the government in terms of assisting ordinary wananchi. Kenyans, I'll call not civil society, but civil society and civic society, just individuals, associations, groups of people coming together who just want to go and deliver food and other essentials, especially to the poor living in our informal settlements. That is continuing regardless of the government's advice. I think it's because Kenyans know their government sometimes better than the government knows itself.
Recently, the Kenyan government banned the uncoordinated direct distribution of food and non-food donations, asking Kenyans willing to help to channel their donations through the Kenya COVID-19 Emergency Fund. So are there systems in place to enable Kenyans to track their contributions to those affected by the coronavirus?
Unless evidence is produced otherwise, Joki, they don't. And so, yes, that was an order made by the government that we should channel the resources through government. I don't think that will happen. I don't think it's happening. I think Kenyans have ignored that. Even at a very personal level, we're Africans, so people have families, have friends, and if I have potatoes growing in my back garden, and I have relatives and friends in another part of the city who I need, and they ask for it, I will deliver them. I will not take them to the Ministry of Health because the likelihood of them reaching who I want them to reach is not likely. So that kind of personal approach will continue. Doesn't matter what the government says. I think Kenyans will ignore that and proceed. And what do? You arrest people for distributing food? I think it's a contradictory and not very wise order. However, one can appreciate where the government is coming from. The one thing that the COVID-19 pandemic has shown us, one big lesson across Africa with regard to public health, is the extent to which public health across large parts of Africa has been outsourced to civil society and donors. So, we'll have HIV/AIDS programs in certain countries, which are entirely funded by donors, where the agenda is set from the outside. And I think this has brought, COVID-19 has brought it home, the extent to which just general public health was outsourced, and we've instead spent quite a bit of resources focusing on clinical health, on our hospitals, on buying scanners, ventilators, etc., which is important. But you have some countries, South Africa, Ethiopia, Rwanda, where it will not be possible for individuals or NGOs or foreign governments to just walk in and get involved in public health issues without going through the government. So here, we don't have the infrastructure for the government to do actually what it is supposed to do. It should not take the government ordering us not to be haphazard in our distribution of aid to our own brothers and sisters, friends. It should not take that. It should have, if it was the culture, we would have automatically all lined up outside the Ministry of Health and delivered there. That machinery and culture isn't there. And so I think that the informal, quote unquote, haphazard distribution of food and other items that ordinary people need is going to continue regardless of what the government says.
Right. And so a couple of weeks ago, the government also announced that they're going to be spending 2 billion that was repatriated from stolen funds in the fight against coronavirus. So this is money that was earlier stolen from public coffers, and now it's going to be channeled to fighting coronavirus. John, maybe you can tell us what you think about that. What are your thoughts on that?
I think it's a positive step. What struck me about that particular action, which in other circumstances would be an action that would elicit a considerable amount of attention and excitement, that money which has been repatriated or restituted back to the government or has been seized by the government from the proceeds of corruption, that should cause some excitement. And we saw in the newspapers the Director of Public Prosecutions handing over this check to the Ministry of Health and to the team that is involved in leading the fight against this pandemic. But it actually caused almost no public excitement. I think that, again, as I said, 2 billion shillings is peanuts compared to what has been stolen from the Ministry of Health and continues to be stolen from the Ministry of Health. And I think that's the reason it didn't capture the attention of the public in that way. It's a good move. It's a small tactical move.
Small tactical move. So it appears like the Ministry of Health, it's ironic that the conversation we're having about holding governments to accountable has a lot to do with the Ministry of Health, which has been dogged by corruption scandals for a really long time. And it appears right now that the Ministry of Health is fighting two battles. There's one against the battle against coronavirus, and another a battle against the cartels. The other day, the minister said that he's going to bring down the cartels, and he is not new to this kind of stuff, and he's not going to be pulled down. So, what are your thoughts on this situation? The fact that we have a ministry here, on one hand, is fighting a global pandemic, where cases keep rising, an average of maybe 2025. But on the other hand, there are also there's this other fight against cartels who are just waiting to grab whatever it is that could be grabbed.
I think that I think part of the challenge our Ministry of Health faces goes back to the issue that I raised in response to an earlier question, that our public health system in Kenya is quite fragmented, and because we have the public health system and we have the private health system, and really another big lesson of the COVID-19 pandemic has been the importance of the public health system, of having a public health strategy in place. Fortunately for us, we had some of the preparations we had made for Ebola and other diseases. Some of that infrastructure was in place to apply to COVID-19. I think the issue which you're raising with regard to the Ministry of Health is one of the Ministry of Health's capacity in Kenya that it hasn't had. So actually, the face of the fight against the pandemic on TV is the Minister of Health. On the ground, it's the Kenya Police. So it's Ministry of Interior and the police. So there's that disconnect that comes out of our history and culture. So I would reframe that question in terms of relevance given our particular context and the challenges that this particular ministry faces, which ignore talk of our own historical experience.
Okay, so you previously mentioned countries like South Africa and how the government in South Africa was tasked with the COVID-19 response fund. But the question many people are asking is how does Kenya compare with other countries in handling of public funds? This is not a first. We are not the only country in Africa that's having this issue. So how do we compare with other countries?
I mean, the polls that are done regularly around corruption and appropriation and illicit finance by groups like Transparency International show that Kenya continues to be the bottom 25% of countries in terms of being amongst the most corrupt countries in the world. So that does impact the environment in which huge resources are going through to respond to something like the COVID pandemic. I think on the money, may miss the point. The truth of the matter, South Africa, Ghana, Uganda, Ethiopia, Rwanda, I think I've already mentioned, a whole range of countries, Botswana, Namibia. We are seeing African countries discussing this with colleagues, especially those countries that are led by liberation movements, seem to have responded a lot more effectively to this crisis than other countries. So, South Africa very quickly set up a solidarity fund into which the private sector was, very quick to contribute and continues to contribute. And they have a level of transparency in terms of the way those resources are being expended. But it's very, very helpful and very reassuring. And so I don't think we are there yet as Kenya. That's our culture, our history, and it's unfortunate that the first expose vis-a-vis the spending of COVID-related funds has been a scandal. But as I said, not particularly surprising for this government, given the experience of the last 7 to 8 years. So I think that, that said, there are governments across the continent that are doing extremely well. There are those that aren't doing very well, and I think Kenya is somewhere in the middle.
Okay, so there's a question here from Patrick Gadara. Alex, do you want to tackle that?
Yeah, so thanks, John. So Gadara's question relates, I think, to the point you made earlier on outsourcing of public health to donors and civil society. So Gadara's question is, to what extent have CSOs and NGOs been involved in crafting rather than supporting government of Kenya's COVID response? And how does that affect citizen participation? Is the first part of the question.
I think that we have to admit that entire chunks of our public health system have historically, at least since structural adjustment, but it accelerated in the 1990s, and really over the last 15 years has become a much more serious issue. We outsource this public health, just which is the simple part of what seems to be the simple part of national health policy. Primary health, the management of HIV/AIDS pandemic. Those, if you walk into government departments and ministries, you look at the resources that are being spent on public health. Many of them, most of them, come from donors. And if you talk to academics and researchers at the University of Nairobi, they will tell you that. They'll tell you that actually, in the School of Medicine, they teach it, but without foreign funding, it can go very far. So yes, our policies have been made for us by NGOs and in public health, and I'm really hoping that's one of the lessons that we will learn out of COVID-19. As I mentioned at the beginning, South Africa, Rwanda, Ethiopia, there's no donor or NGO that can just walk in and start, and especially walk into the health sector, walk into the education sector, walk into security, and start, delivering policy just like that, without going through the government in a very structured way that is in keeping with the government strategy. I mean, one of the things that the Kenya government did fairly early, which was an indicator of the situation here, is that we contracted McKinsey, which is a global consulting firm, to sort of help us come to grips with understanding this COVID-19 pandemic. And they produced an Africa report, they produced a report for Kenya and a number of other countries. And so you can tell those countries that quickly went running to, it's fairly ridiculous for a government to go to a an American consulting firm to help it respond to a pandemic crisis. Sometimes ignoring the fact that we have, and I think COVID-19 has demonstrated it, we have considerable capacity and experience within ourselves as Africans to respond to this. If you look at the speed with which people are making their own masks, in Senegal, they developed a test for COVID-19 that was very quick. You have, across Africa, industries making PEPs, these personal protection equipment, and you have in some countries, reports of people, building ventilators. So I think we've also underrated the resilience of Africa and Africans, given this kind of pandemic. Pandemics are not new, and HIV/AIDS, Ebola. We are there. As Professor Mohamed Bakari, one of our acclaimed academics and linguists, told me, this kind of virus is part of the human ecosystem. It's going to be around. So, in a sense, we are used to it. And we unfortunately outsourced public health to donors. And I think we've paid a price, which is the reason, immediately when COVID-19 comes around, we go over to people like to consulting firms to assist in the response. I think the answers are amongst us, and I think if there's one big lesson we've learned is that from now on we use our own academics, intellectuals, and experience to develop policy and spend and change our spending patterns. Spend perhaps less on.
So John, I let it back to the last question. Is he suggests that perhaps the fact that we outsource thinking, the logistics, the implementation arrangements, as well as the money resources, does that then create kind of exacerbate the erosion of accountability to two things? One, to the results, to the outcomes, whether these are effective, because we didn't write them. And then the other one is just accountability to the resources. The fact that it's not coming from our own coffers, it's donor money, and people say it's somebody else's money, and we probably don't even believe in the cost that the money is being channeled to. Does it then create this real incentive to just pillage the money and never use it for the intended reason the donors gave it in the first place?
I think so. I think, and I think it's unsurprising. In that people's investment in people's ownership of policy in this area has been low because of the strategy that we've adopted, and so yes, it partly explains the reason our health sector has been plagued by so many scandals, despite the tremendous impact of failures in this sector has on society as a whole. And I would like to think that if there's one big lesson that's coming out of all this, is that we've got to develop our own public health policy. We've got to implement it ourselves. Doesn't mean that we can't ask for help, but it has to be help into a strategy that we have developed for ourselves. And once you have that kind of ownership, then accountability becomes easier. Right now, without the ownership, accountability is much more difficult.
So another question from one of the participants is doubting the low numbers that are being declared in Kenya, for instance. We're only at 700 in the frame of the pandemic and some of the patterns we've seen in other countries. More or less 60 days into this situation, we should be in the hundreds or tens of thousands, but we are at 700. So the participant asking whether these low numbers could be political.
I think I've heard that question asked many times. I think that's just it's partly a function of mistrust of government. So people, the government is damned if it doesn't, damned if it doesn't. right now, especially because our government already had a significant trust deficit with Kenyans. So there's a sense in which whichever figure we give out, there are those who will doubt them, and when others produce figures, people will sometimes tend to believe those a bit more. However, going to specifically to a question that you have asked, and I am not an epidemiologist. I've the past 2 months been interviewing a lot of them and having discussions with people who dealt with these kind of pandemics before, whether it's Ebola, whether it's HIV/AIDS, and the kind of mapping that was being done especially by our statisticians and epidemiologists, given when we had our first rush of cases, seemed to indicate that between the middle of April and the middle of May, in other words, up to this week, should have been the time when, if we were following the kind of trajectory we've seen in the West, in the US, in Europe, that should have been the steep rise. And the same was said around for many countries across the African continent. However, we have not seen the kind of steep rise in numbers that many had predicted, and therefore, people, of course, we're not testing as widely as any of the countries in the West, or as widely as countries like Ghana, for example, or South Africa, which have compared far more widespread and rigorous testing regimes, Senegal. So it's true. There's a lot of possibly people who are infected with coronavirus who are not being picked up by the system. And unfortunately, when you're faced with that kind of reality, you look to a country like Ecuador, where there wasn't much testing, and when the coronavirus pandemic hit, the figures went up astronomically, but the pandemic became very visible on the streets, in the morgues, in the hospitals, because the morgues were full, bodies were being left on the side of the road. You could tell people were being killed by COVID-19. People are dying across the country, and so the pandemic became very visible. One hasn't gotten the sense yet that our mortuaries are full and that people are lining up to outside our hospitals, even though our quarantine protocol that government introduced was a very unfortunate one, because it has caused people to mistrust government still further. It's a very punitive approach, so people are also afraid of coming forward to be tested and that kind of thing. That said, I don't think we should discount the fact that the initial measures that were implemented by many African governments, including Kenya, of locking down populations, of restricting movement, stopping flights, of keeping people at home, have had an impact. I believe they have had an impact. Otherwise, we would be seeing a very different situation. Look at Tanzania, which has opted for a different approach and are suffering far higher figure that you can see. We are friends are sharing with us reports and videos of people who are dying in the streets. So I think number one, as most of sub-Saharan Africa, quick action by governments. This first round of infections seems to have been mitigated to an extent. Otherwise, by now, in the last 30 days, it should have shot up. I think it hasn't. I think the numbers are higher than the ones the minister is giving us, because they're not doing that much testing. But I don't think that it is as catastrophic as some people are predicting in the very beginning. In the second round, I don't know, but I think we learned some important lessons. So I think there are those two factors in play around the numbers. We are not testing, So it might not be that high, but we also have to acknowledge that the government's interventions have made a difference.
So John, another question, and this I think goes to your engagement very widely in the country through your Inuka efforts. You've traveled the width, the breadth of this country, and the question is about marginalized communities, people off the grid, and this dealing with a pandemic of this kind really requires intense information. And all of these come through radio, they come through internet, they come through TV. Word of mouth sometimes has all the distortions that we know. So the question is whether, are we with our current mechanisms of communication serving the vast majority of Kenyans to elicit the kind of engagement and full participation to help combat this pandemic?
I think obviously those the marginalized in our society are suffering the most. Not only from this pandemic, but from the measures that have been implemented to mitigate it, and the economic slowdown this has caused, the tremendous disruption that has made to people's everyday lives, affects those who live, day to day on the resources that they're able to earn on a day-to-day basis through their labor or their trade and commerce, and they are very, very impacted by by this pandemic, and we for the last, I would say, since around 2010, 2011, and more strongly since 2013, the Kenya government has had in place a cash transfer program meant for the elderly, widows, orphans, the disabled. It's a significant program, and between 2013 and 2019, I think about 60 billion shillings has been expended, money which direct cash transfers for the elderly, people who are 70 and above, and that was reduced to 65, who are basically supposed to receive by M-Pesa or whatever a certain amount of money every month. And I think that this whole program, you mentioned earlier about the auditing of COVID-19 funds. I think that would be auditing just one response, one initiative by the Ministry of Health. I think that the cash transfer program also needs to be audited, because it's going to be an essential part of our response to this pandemic going forward. Going forward.
John, the next question really goes at the heart of the conversation we're having as a country. We saw the arrival on stage of Cabinet Secretary Mutahi Kagwe. In devolution, we devolved healthcare. But right now, healthcare is back as a critical central government function, national government function. Does this in some ways undermine the confidence that either the national government or the public has in devolution? One of the participants is asking whether this goes against the commitment, the constitutional commitment to decentralization and devolution. Health is devolved, people live in counties. If by some of the counts that we see a spike or a surge in COVID, it's going to hammer our counties just as much as anybody might think. And why wouldn't we channel resources, capacity, infrastructure, logistics, and capability to county governments? Why is this such a preserve of the national government? We have a national task force to deal with the COVID emergency. We'd expect to have chapters of this in counties, to have some capability in counties, to have a channel for distributing the resources, for a channel for response, gearing up health infrastructure, etc. But what we see is an over concentration of resources and capacity at the national government.
I think that's that's a correct observation. However, one needs to look at the nature of this. This you know this is a global pandemic. It requires the engagement of nation states at the very highest level. You need it's only the national government that can close airports, that can close borders, that can lock down entire parts of the country, etc. So some of those decisions and choices have to be made at that level when you're dealing with a problem of this scale. That doesn't remove the responsibility of health providers in our counties. I think some of them have done very well. I think the first sort of making of masks that are now being used everywhere came out of the county of Kitui. And I think it's essential. Everyone's been talking, for example, about Sweden, and Sweden's quite different approach to dealing with the COVID-19 pandemic, where they appear to have approached it with the attitude of going for a herd immunity approach centrally. And the government's chief epidemiologist has been on TV rationalizing it, and so you think that is where all the instructions are coming from. But no, they actually have a very devolved system. It's just a very coherent system that very, very efficient methodologies of interaction between central government and the counties, that they're working together towards one goal, and there's a high level of trust. Kenya, we have a level of politics and polarization that sometimes is a bit difficult.
Yeah.
Okay, so we have a question here from Josephine Ojambo, who is asking, what are the human rights implications of the government's response to COVID-19 pandemic?
I think that in the first instance, of course, as I said at the beginning, even though the Ministry of Health is the agency that we're seeing on TV talking to us about COVID-19 mitigation and how we should change our behavior, on the streets, the agencies that are implementing our health policy, our response policy, are the security services, police and others. And whenever you have that kind of situation, you will have, widespread human rights abuses, especially affecting people living in informal settlements, impacting very heavily on women and the most marginalized in society, especially when you're talking about the enforcement of curfews and those kind of measures. When you securitize your response, then the human rights implications are almost immediate. It's how you then attempt to mitigate that. And I think in Uganda, and if I'm not mistaken, it may have happened here as well, but in Uganda, the chief of police apologized for some of the excesses of the police in enforcing the curfews and the lockdowns in the beginning. And the president created a helpline for anybody who has got problems to call in, and the complaints around this area in terms of human rights abuses declined. So it's partly as a result of the fact that we have put front and center our security services as the first responders to the COVID-19 epidemic. because our health system is quite weak.
So, John, the next question is on the disconnect between the experiences of wananchi and the reality of our politicians. Politicians don't seem either to understand the local needs and challenges or don't seem to care. So the questioner is struggling to pinpoint which it is. We have numerous egregious examples of this, such as the recent home demolitions in Kariobangi. So how do we, as journalists, academics, civil society, Kenyans on Twitter, for instance, use our local knowledge and experience to either bridge this gap, and how do we influence our elected leaders to act in the interest of common Kenyans and make policies that are actually contextualized and beneficial to the population? Could we also not partner with massive advertising agencies for the common public good in terms of messaging and accountability? I guess the whole question is what the government is saying, what's the lived reality? We also talked about securitization of a pandemic. It's not a health emergency, it's actually a security emergency. I think we have more boots around than doctors and nurses in hospitals. So the question really is the disconnect, and the government basically has its own logic and citizens are living in reality. How do we bridge the gap?
Yeah, sorry, you are a bit unclear, but I think I caught the question. I think that the Kariobangi demolitions were, given the kind of situation we're in, that was really almost like an atrocity to go in and render, 5,000 people homeless in the middle of a pandemic. Shows either huge incompetence or just total disconnect from reality. Really, just people who just don't have a sense of reality, or just a very high level of corruption and capture of elements of the state by private interests. So that doesn't recognize that we're in the middle of an emergency that requires us to be sensitive and to listen to our own people and their needs at this time, and put their health needs very, very much at the forefront of our all the government does. So I think that those demolitions impacted negatively on the government's credibility and legitimacy as it goes forward in fighting this pandemic, and that was extremely unfortunate. And one hopes that lessons have been learned from it, because if they haven't, as you said, you were talking in the beginning about asking people to be less haphazard in their relief efforts, and the government saying give the resources to them. Why would you give resources to a government that is helping to spread COVID-19 by demolishing people's homes in the middle of a pandemic, making physical distancing even more difficult than it is for the poorest in our society? So that would be my response in that regard. Number two, you raise a very good point about the messaging, and I think just watching Minister Kagwe on television as he gives his regular updates. First of all, he has come in as a breath of fresh air. He speaks with authority, and I think he's a figure that Kenyans trust definitely more than his predecessor. So that I think was a good choice, and I think it is helping the government, not only helping the government but helping Kenyans, because we need to have quality information coming out of government at this time. Yes, I think there's
just to cut you short, I guess the question really that is raised a lot of times when Cabinet Secretary Kagwe appears is, it's all great to give detailed, articulate, eloquent updates, but what's still missing in the public conversation and in terms of confidence in how the government is going to do this is, where is the plan? We have a surge of COVID in the country. Is Turkana ready? Is Busia ready? Is Kilifi ready? Is Kwale ready? is TVETA ready, for instance? And I think that's the line of sight that a lot of people don't see. We appreciate the update. The question is, what are the real plans? And I think this goes back to the question of where is the coordination between the national government and the counties? Because the rubber is going to hit the road in the counties. That's where we'll see the fatalities. And to link that comment, Gadara is still doubtful about the government's capacity to convince us that there's not too many Kenyans dying from COVID, because even doubts our capacity to collect data on cost of death, etc. So I think it still goes back to a complete erosion of public trust in government in many senses.
Yeah. I think this, when I watch the minister on TV, and I think perhaps our communications and PR professionals can assist us. This particular government's posture with regard to communications with Kenyans is from public. It was the infrastructure of communications with Kenyans was developed for elections. It was developed for public relations. That's what it was developed for. Very effective in its own way. In 2013, it had presence in mainstream media, on TV, radio, on social media. Very strong presence. Very coherent teams put together who are doing political messaging. So this government is one that invests in the kind of messaging that you're talking about, but it's messaging for public relations. It's messaging. It's an infrastructure that was developed for elections. What you see happening in countries like South Africa, Ghana, if you look at Kaduna State in Nigeria, you look just across the border in Tanzania, and President Museveni is on TV in his mask giving 1.5 hour long interviews where people, where questions can be asked by a variety of people. So there's a difference between public relations and communications, where you're actually communicating to people. If you look at the Singaporean Prime Minister, when he gives a press conference, he gives it in all the different languages that are prominent in Singapore, and describes in detail, this is what we are doing, this is what's happening, this is where it's happening, this is what we're doing about it, who, what, when, how, that, and it's reassuring, that just that sense that you're listening to people, you're calming their anxieties, you are managing their concerns, and you're telling people exactly what you're doing, what's going right, what could be done better on an ongoing basis. It's just giving the people the truth in a steady sort of way. And so when you see the president of Uganda doing press ups on TV in State House, Nakasero, that's brilliant communications on the part of a head of state. He's telling people, listen, you don't have to go outside to walk around to exercise. You can do it in your house. This is the way you do it. And he does the push-ups. That's communication, very different from public relations. Public relations very quickly gets exhausted. And therefore, we are forced to turn to social media, we're all scouring the internet to look for what's happening. And I think that's perhaps what needs to be corrected, is for the Kenya government to chill out on the PR and actually do some serious messaging that speaks to our concerns and tells us exactly what's happening, what they're doing. It's no embarrassment to say that we're not completely, we were never ready to do this amount of testing, but we have now got this number of test kits in the country. We are testing here, we're testing there, and just to tell people, even when it's a painful truth, you tell them, because then you begin to build trust. The Singaporean Minister of Health or Prime Minister very, very early said that yes, you need a good, solid public health system, but as important as that is the nature of your governance system. And number two, social capital. You need to have the confidence of your population. You need for them to believe you, whether you're giving them good or bad news, that they believe you, that they trust you, and that they will make their choices and decisions based on what you have shared with them. And this has been for me the starkest difference between those countries that have done well in Africa and those that have done less well. In our case, we have a minister who's a very good communicator, in my opinion, but the model is a PR elections related model, and the machinery is of that nature. Whereas what we need now is somebody who can communicate and that in a way that speaks not only to our minds, but also to our hearts and to our concerns, our fears, in a manner that reassures us.
So, John, another question from Gadara is, will COVID fundamentally change how media works and is resourced in Kenya? Or do you expect that the media will revert to its pre-crisis operations or once the crisis is past? We have seen journalists' salaries being slashed and the intensification of job losses, as well as loss of advertising revenue. Will this be reversed, in your opinion?
I don't think that the trajectory with regard to the existing predominant media model, which is the advertising-based model for mainstream media, for corporate media around the world, that model is collapsing. And it's not only a Kenyan phenomenon, it's a global phenomenon. That disruption will continue. In some ways, it finds itself perhaps accelerated by a pandemic like COVID-19, simply because by the time the newspaper is printed and published, people have hungrily absorbed a huge amount of information via online platforms like WhatsApp, Facebook, and the like. And so the nature of media was already changing. And I think in irreversible ways, I think all that COVID-19 has done is to accelerate that. And I think that because of the economic impact of the measures that we've implemented to mitigate it, advertising revenue, which was already, heading south, is going to get even worse. So COVID-19 has simply accelerated a trend that was already there, and it's how we repurpose ourselves in media to be a lot more prominent online and to add value to, as you said, Kenyans quickly got tired of the minister telling them how many people have died, how many people have been infected, etc., etc. People very quickly got tired of that. They want to know how is this pandemic behaving? What are the hotspots? What should be, how is it affecting old people? How is it affecting women versus men? People want added value. Just statistics alone these days just don't cut it, and better information can be found elsewhere.
Right. So, as a publisher, how does smaller news and analysis outfits such as the Elephant, how are they doing compared to the so-called legacy media? And what is their role at a general perspective in providing news and information for Kenyans around COVID-19?
I think that, again, this is part of a global trend. This is not something that is unique to Kenya, because Kenya has traditionally had the most sophisticated, well-resourced, and free and open legacy media in the whole region, this whole part of Africa, from Congo up to South Africa. Kenyan media has been the strongest, and it's going through this major disruption. And the emerging model is one that sees smaller media organizations emerging. Elephant is very small. I always tell people the Elephant's budget is not half of the annual salary of a senior manager at the Nation or the Standard. So, no comparison. The value addition is in the relationships that media has forged with like-minded partners and similar entities around the world. Digital technology makes that very easy. That if I want to find out, so for us at the Elephant, for example, to being able to speak to people, Malaysia, Singapore, India, to find out how they're dealing with coronavirus, and to share information, to share content, so that you're adding value for your viewers and readers. And it's just to be very, very nimble and to innovate all the time. The digital disruptions up to now in media have been happening once every 18 months. We had not anticipated the COVID-19 one. It has led to one innovation. The very fact that we are on this Zoom call is a sign of the kind of innovation that media has been forced to do, in my opinion. This is the kind of conference that would have taken place in a hotel, that Aga Khan University would have booked. I think that phase is over, at least in the scale that it was there before. And we'll be staring at each other on computers for quite, that is really the future of media in many respects. So, however, that doesn't mean that we still very urgently and desperately need the kind of media that goes out into the community and tells us what's happening in Kitui, what's happening in Kisumu. I think that's extremely important. So I think that media networks will prosper in this time. We have now giant collectives of especially investigative media collectives that have grown around the world, and that seems to be very much the direction. It's cheaper, and it also allows more value addition. So you have more academics, more different, in a sense, the news desk is ending, and a lot of new capacities being thrown. What media means is what is changing. It's and just that technology and the economy are forcing that transformation. This pandemic has accelerated those changes intensely.
Donors, the private citizens, corporates, the government itself, we're raising a lot of money. Njoki just went through some of those in our opening. Are we creating a grand recipe for corruption? Just because it's going to be extremely difficult to hold the public sector accountable for the resources that are being raised in the name of fighting COVID. Do you have any fears, or are you more hopeful?
As I said in the very beginning, Alex, whether it's the Haiti earthquake, Hurricane Katrina, when you have huge sums of money being spent in a very short space of time, you will have problems. You will have people stealing some of the money. You'll have some of the money going awry. You'll have the wrong stuff being bought. After one day somebody's going to open a big go down and find all sorts of stuff which is meant for COVID-19. That's the kind of thing that happens when you spend so much money so quickly without the capacity. So that's number one. Number two, we are a systemically corrupt country. So, I mean, the cartels don't stop because of a pandemic. I think they were very, very uncomfortable for a short while because they could not meet, and it's very difficult to conspire to steal money over Zoom, and you don't trust Zoom. These are conversations that need to happen mundu kwa mundu, and so I think there was a discomfort there, and part of the this is anecdotal, but some of the evidence that's emerging in terms of high-level infections amongst the elite in different parts of Africa, especially in more corrupt countries. Politicians, these entrepreneurs, lawyers, and bankers are high on the list of people who are getting infected because these are the essential players in stealing the money. So, but unfortunately, the stealing will continue. It would be really wonderful if this kind of massive disruption to our society could be used by the ruling elite, whether it's government and opposition, whatever remains of it, to take this opportunity to sort of reboot our governance system. Because right now, Kenya's response to COVID-19, I think, has been okay so far. It would be great if we were not carrying the ball and chain of our governance challenges, where we can tell there's a huge amount of political realignments that are underway on the political front and preparations for the 2022 elections, and the stealing is ongoing. People don't stop stealing because a virus has appeared. These are transactions that had already been embarked upon, and it would be great to hear if the CID and DPP are even looking into some of these problems, especially now. It's particularly gross to really be stealing at a time when the resources are so urgently needed to respond to this crisis.
Ladies and gentlemen, this brings us to the close of episode 4 of the Understanding COVID-19 series, brought to you by the Media Innovation Center, the Aga Khan University. Thank you, viewers and listeners, and a special thank you to our guest, Mr. John Githongo, CEO, Inuka Kenya, our moderators, Dr. Alex Owiti, Vice Provost East Africa and Interim Dean of the Graduate School of Media and Communications, and Ms. Njoki Chege, Director of the Media Innovation Center. Join us next week for episode 5 of the series, where we will host special guest Professor Bintange Demo, ICT champion and Professor of Entrepreneurship at the University of Nairobi, where we will probe the topic, how technology has enhanced our capacity to cope with COVID-19 pandemic. Could it have been worse? Please follow us online at our Facebook and Twitter platforms at AKU Media Futures. That is AKU Media Futures. Once again, thank you, and have a wonderful and safe afternoon.